Hi, I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. And I teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Today, we're going to talk about something every clinic has to deal with: revenue, and more specifically, how care management actually generates revenue for clinics. Because a lot of providers hear about care management and think this sounds like more work. And it is work. But what they don't realize is this is one of the few models in healthcare that improves patient outcomes and creates consistent recurring revenue. Let's start with the bigger picture. Healthcare is shifting. We're moving away from a system that only pays for visits to one that supports ongoing care. And CMS, the Centers for Medicare and Medicaid Services, has created specific programs to support that shift. Two of the most common are chronic care management, or CCM, remote patient monitoring, or RPM. These programs are designed to reimburse clinics for the work that happens between visits. Now, let's take a closer look because this is where a lot of people miss the bigger picture. Let's say you have a primary care clinic. They're seeing patients every day, back to back visits. But once those patients leave the office, there's no structured follow up. No one is consistently checking on them. So all of that care stops when the visit ends. Now let's look at that same clinic with care management in place. Those same patients are now enrolled in CCM. They're receiving monthly follow up. Their medications are being reviewed. Their care is being coordinated across the care team, including the provider, office staff, care manager, and other healthcare professionals involved in the patient's care. And the clinic is being reimbursed for that work every single month. That's the difference. Now let's talk about CCM specifically. With chronic care management, clinics are reimbursed for providing at least 20 minutes of non face to face care per patient per month. This means the service can be provided remotely by phone or other electronic communication. The provider does not have to be present for the service to be delivered. These services include patient follow up, medication management, care coordination, ongoing support. Now, think about this from a business perspective. If a clinic enrolls 50 patients, 100 patients, 200 patients, that becomes recurring monthly revenue, not tied to visits, not dependent on patients coming into the office, but based on consistent care delivery. And that revenue grows over time as more patients are enrolled. Now, let's put some real numbers to this. On average, Medicare reimburses around $60 per patient per month for CCM, depending on the code and level of service. So let's say a clinic enrolls 100 patients. That's about $6,000 per month in recurring revenue. If that grows to 200 patients, that's around $12,000 per month. And again, this is not tied to office visits. This is revenue generated from ongoing care. And the key here is consistency because this isn't a one time payment. This is recurring month after month as long as that care is being delivered. Now let's look at RPM. Remote patient monitoring allows clinics to track patient data like blood pressure, blood glucose, weight, oxygen levels. Patients use devices at home, and that data is transmitted back to the clinic. Now, instead of waiting for a patient to come in with a problem, you're seeing trends in real time. You can identify issues early, you can intervene sooner, and clinics are reimbursed for setting up the devices, monitoring the data, engaging with patients based on that data. So now you're not just improving care, you're creating another stream of revenue tied to ongoing monitoring. Now, let's take it one step further because this is where it becomes even more powerful: value based care. Providers are no longer just being paid for volume, they're being measured on patient outcomes, hospitalizations, patient engagement, total cost of care. And here's the connection: care management directly impacts all of these. When patients are followed consistently, when issues are caught early, when care is coordinated, outcomes improve, hospitalizations decrease, patients stay more engaged. So now clinics are not only generating revenue through CCM and RPM, they're also performing better in value based models, which leads to additional financial incentives. Now, let's talk about something that often gets overlooked. Some clinics try to implement these programs using unlicensed staff, and this is where things start to break down because care management is not just task based, it's clinical. It requires assessment critical thinking, clinical judgment, the ability to identify risk. Nurses are trained to do this. We don't just follow a script. We assess the patient, recognize changes, and ask the right questions. We intervene when something is off, and we communicate effectively with providers. If a patient reports new symptoms, an unlicensed staff member may document it, a nurse will assess it. There's a difference, and that difference impacts outcomes. When nurses are leading care management, patients are better supported, issues are identified earlier, documentation is stronger, care is more consistent, outcomes improve, and that directly impacts both reimbursement and performance. So, yes, care management generates revenue, but more importantly, it generates sustainable revenue because it's tied to ongoing care, not one time visits. And when it's done correctly, it strengthens both the clinical and financial side of a practice. So if you're looking at ways to grow your practice, improve patient outcomes, and build a more sustainable revenue model, care management is one of the most effective strategies you can implement. If you're a nurse and you want to learn more about care management and how to step into this space, I share more inside my online school community, Empower Care Academy. I'll leave the link below so you can join us. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.